let's go. Okay. According to the U.S. Census Bureau, in 2014, 33 million people in the United States do not have access to health insurance. That means that at least 10% of the population are unable to get proper health care. The United States, Greece, and Poland are the only countries of the 34 of the for Economic Cooperation and Development do not have universal health care. But given all this information and learning that the United States is among the few who does not offer universal health care, you have to wonder, why is it not available? The United States is a very wealthy country and is in a predicament where it is certainly possible. A change this major will benefit most of society, all the medical bills, and all of the pay deductions as a result of health coverage and insurance will be a thought of the past. In this presentation, I will discuss the two elements of the controversy of universal health care. The presentation will include both the benefits and the downfalls of universal health care systems. The finance side of universal health care. One of the most difficult aspects of the healthcare industry is when the billing issue. Doctors must contend with multiple insurance plans, multiple diagnosed coding for billing purposes, and it must all be done within a certain amount of time for proper compensation to be received. Universal health care would eliminate most of the issues because there will be less overall competition from the insurance industry. It will be far less stressful on everyone involved. Patients will be able to walk in and receive adequate care without fear that they might not be able to cover the fees for their visit. When a person mentions universal health care, the average person usually assumes it is free, but actually universal health care has several contributing factors that make it total opposite. Free health care really isn't free. It is often paid for in extra taxes somewhere. This can affect a family's budget in several negative ways. That is often the primary issue that we may see with universal health care. Instead of paying for services as you might need it, you're paying for everyone's service all the time. This means you just your paycheck will be higher, deductions, but not just you, but for everyone. This means that there might not be a month that you are not sick, you do not need assistance from a doctor, but you still pay a fee. Saving lives and increasing wait time. On the other hand, there are studies that praise the fact that universal health care system does work. According to a 2009 study from Harvard Research, lack of health insurance is associated with as many as 44,789 deaths per year, which translates to 40% increased risk of death among uninsured. Another study found that more than 13,000 deaths occurred each year just in the 55 through 64 year old age group due to lack of health insurance coverage. Our society desperately needs something to help provide an outlet or means to get help. This system will help to change the lives of citizens for the better. In addition, a 2011 Commonwealth Fund study found that due to a lack of timely and effective health care, the United States ranked at the bottom of the list of 16 rich nations in terms of preventable mortality. This means that there are preventable measures that the country could have taken, but instead they didn't. In Italy, Spain, France, Australia, Israel, and Norway, all countries with the right to health care, people live 2 to 3 years longer. People in the United States, so just by changing our health care, people will be more willing to go out and seek help, which will translate to living longer and much more person's life. They will no longer be stressed out how they will pay for health care or how much they will have to pay due to an illness or pain. Medicaid is an example of federal funded single-payer health care system that provided a right to health care for low-income people. According to a 2012 Government Accountability Office reported 9.4% of Medicaid beneficiaries had trouble obtaining necessary care due to long wait time versus 4.2 of people with private health insurance. Countries with a universal right to health care have longer wait time than in the United States because they are not worried about a bill, but only the health. In the United States, it is not uncommon for people to ignore their illnesses, because they would rather fight the pain than to be stuck with an excessive bill. In 2013, the average wait time the wait time to see a specific in Canada was 8 to 6 weeks versus 18.5 days in the United States. The universal healthcare system is not like any other idea because it has both negative and positive aspects. I however believe that healthcare is the right and that everyone should have access to it. So the questions for the United States faces to whether make the change or to stay the same. With costs rising every year, the free market system is becoming outreach for the average American with increasing income. Something should be done, but is that something universal health care? What do you think?